Okay. Hello and welcome to Health Live at Seniors Today. We are privileged to have here with us a veteran oncologist, Dr. Anil for our health webinar today. A little about Dr. before we welcome him here. Dr. is Director of Oncology at the Apollo Cancer Centers. He is well recognized as a global leader, clinician, researcher, and teacher in head and neck oncology. He was director of Tata Memorial Hospital and chief of head neck services with over 33 years experience in the field of cancer. Dr. is currently president of the Union for International Cancer Control, that is the UICC, which is headquartered in Geneva and is the largest cancer organization globally committed to the cause of cancer control, comprising over 1,000 member organizations across 171 countries. Established in 1933, that is the UICC, he is the first Indian to hold this position in recognition for his professional standing in the field. He was also awarded the honorary FRCCS from the Royal College of Surgeons in London. Dr. has held various leadership positions and is on the board of numerous professional organizations, universities, research organizations, cancer institutions across the country and abroad. He is an avid researcher and has landmark contribution in management of neck nodes in oral cancers, awarded and was awarded the plenary at the American Society of Clinical Oncology in 2015. He worked on research in the use of curcumin and was part of a project to develop and validate molecular cytogenetic studies in oral cancers. Dr. has over 250 peer-reviewed publications and chapters to his name and is a member of the editorial board of many reputed and national and international journals. He has delivered over 500 invited lectures and nearly 100 named lectures across the world. And just today, he is going to be with us, and then he's going to be with another webinar, and et cetera, et cetera. And he's just coming from a tough surgery, as he just told us before this webinar started. Dr. it's a real honor that you are here with us today. Thank you very much.
Thank you, Paddy. Am I heard?
Yes, you are. Yes.
Okay. And I'm going to share my screen. I have a presentation. Right. So I'm going to share my screen.
Yeah, we can see it.
Okay, 1 minute. I need to get it into a slideshow from the beginning. There goes. Lovely. So thank you, Paddy, for those kind words. It's humbling the way you were introducing me. I first want to congratulate you and your team for this lovely initiative on health, targeting a very, very important group, which are the senior citizens. I also want to tell you that apart from all the professional bio that you read, I'll put it very simply. I've been 30 years in the field of cancer, treating cancer, teaching and researching. But I think the last decade in my life, I've added a new dimension, and that is going all over the globe, contributing towards cancer control. And that's what my new portfolio as president, or as my interaction with the Union International for Cancer Control, which is headquartered in Geneva, right next to the WHO, and we are committed to the cause of cancer control globally. So today I thought what we could do, we've got about 45 minutes. I'll quickly run through a few slides to set the stage on head and neck cancers. And then we'll open it to our attendees and we could exchange a few questions, dialogue together, and put whatever I've spoken in its proper perspective. I bring you greetings from the Apollo hospitals, where we have now in the last couple of years kept cancer as a thrust area. Specifically, I practice at two of the Apollos, though I'm director across the entire network. I practice at the Apollo Delhi as well as the Apollo Navi Mumbai, which is to the right of your screen. What is the change? What is the thrust we are doing? We have organ-specific approach. That means each doctor only treats one cancer. And we have evidence-based tumor board. So we do what is best practice. It is not that me as a practitioner can do anything to my patient. Patients are presented to a tumor board. The reason is they get the best current evidence treatment that is due to them. Now, why cancer? Cancer is a disease that's increasing. Cardiology was a problem in the 70s and 80s. It's now all cancer. We had 12 million cases in 2012 globally, 18 million in 2018, and 19.3 million in 2020. 1 in 5 men and 1 in 6 women worldwide will develop cancer in their lifetime. 1 in 8 men and 1 in 11 women will die of cancer. The incidence is predicted to rise to double by the 2040s in our country, and it's going to be one of the major causes of mortality and morbidity in our country. Worldwide, lung cancer is the most common, 11% of all cancers and 18% of all deaths. But look at our country. 25% of all our cancers are head and neck cancers. And that's why those of you all who must be attending must be wondering, why is he chosen head and neck cancers? It is India's cancer. Contrast this to the West, where it's only 4 to 5% of all cancers. This is the world map put out by the WHO. The dark blue countries are the high incidence areas of head and neck cancers. And if you can see the pie chart on the left, 50% of all cancers, even more than 50, 60% of all cancers are in the Asian subcontinent. And why is this so? Because tobacco is a socially accepted custom in our country. We live tobacco. We see it on our buses, on our trains. This little kiosk selling pan and supari and these little packets is between two chemist shop bang opposite the Tata Memorial Hospital, where I spent more than 25 years of my life. And you can get toothpaste in these chemist shop which have tobacco. And there is a photograph that I put. It's just a way of life for us in our country. And if you look at global adult tobacco survey data, about 42% of our population consumes tobacco at some time in their lifetime, and close to 20% of young children between 13 and 15 in our country would consume tobacco. It's not only tobacco, and I know there are many senior citizens here, alcohol in excess. And for y'all, this is important to know: sharp teeth, ill-fitting dentures, poor dental hygiene, all are responsible for head and neck cancers. Predominantly, this would happen in the oral cavity. And now there's a new cause of head and neck cancers, particularly seen in the West, and it's caused by an infection called the human papilloma virus, or the HPV. This is attributed to younger people getting cancers, non-smokers, and it's predominantly a sexually transmitted disease because of multiple partners and oral sex. Now, head and neck cancers is anything that starts from the brain down up to your collarbones or your clavicle. And I've put a cross section of the head and neck area to show you the number of subsites in the head and neck. But of all these cancers, oral cavity is 40% of all head and neck cancers. We sometimes call these cancers cancers of the upper aerodigestive tract. So if you hear this name, they have to do with head and neck cancers. Apart from oral cancers, you have cancers of the pharynx. Larynx is the voice box. Hypopharynx is the top of your food pipe, which is juxtaposed to the larynx or the voice box. Oropharynx is the top of your throat, which has the tonsils, the base of tongue. And nasopharynx is the part of your nose and the area behind your nose. Now, in head and neck cancers, we also have thyroid, salivary gland, tumors of the neck. But when we talk about head and neck cancers, by and large, we refer to the tobacco upper aerodigestive tract cancers, which form about 60 to 70% of all these cancers. Now, what is the problem? We have very poor outcomes. There are implications on function and cosmesis. Our patients tolerate treatment poorly. They can't afford it. And we just are inundated with a large number of patients. And that's predominantly because people present late. Now, you don't have to be a doctor to know that if you come with this kind of stage of disease, outcomes are going to be poor and your patient is going to have severe morbidity of treatment procedures. So at 2 time points in my career, I did a study looking at why patients come late. Only 10% of patients in our country present in stage 1 and 2. And I want you to only focus on the red in these slides. The delay is often caused by the patients themselves. And it's because they go for non-medical personnel for treatment, alternative traditional treatments, or just are in self-denial. The average duration before patients come to see us is 7 months, and the stage has progressed from 1 to 4. And again, you don't have to be a rocket scientist to know that if you come in stage 1, we have a 90% cure rate. The functional morbidity and cosmesis implications are mild. Costs of treatment are less, single modality treatment, and you'll are back home very quickly. But contrast this to stage 4, the photographs that I showed you. We can help less than 40% of our patients. Functional and morbidity treatment implications are severe, costs are tremendous, and it wipes out families. So we must make an effort to get to doctors or refer patients to doctors when the tumor is at an early stage. And really, it's a paradox that they come late. It's a paradox they get head and neck cancers because we know it's caused by tobacco. Stop tobacco, 90% of head and neck cancers are gone. They have a well-defined progression model. We can easily examine people's throats and mouths. You don't need fancy CT scans. So really, we should be seeing patients in our country very early. Now, how do you know you're at risk for head and neck cancer? Remember that our mouth is normally having a lining called a mucosa, which is pink in color. The moment this changes color to white, red, or white and red, particularly if you're a tobacco alcohol user, it's called a pre-malignant lesion. White patch is called a leukoplakia. Leuko is white, plakia is a patch. Erythroplakia is a red patch. Erythro is red. And the little or the young guy on the right of the screen has a condition known as submucous fibrosis, where the entire mucosa gets blanched. It loses its pink color. It becomes white. You can't open your mouth, and severe intolerance to spices. 20% of these patients will progress to cancer. What about other warning signs of cancer? If anybody has blockage of one side of the nose or bleeding, that's epistaxis from one side of the nose, You have a hoarseness change in your voice. There's odynophagia, which is pain when eating, a foreign body sensation at the back of your throat. You have dysphagia, that is difficulty in swallowing. The food doesn't go down. You have neck nodes, which are more than a centimeter and can be felt, little lumps in your neck. Or if there's sometimes just referred pain to the ear, there's a growth inside and you get pain in the ear. Any of these symptoms, particularly if the patient is a tobacco and alcohol user, and these persist for more than 4 weeks, you need to go see a specialist. How do we treat these cancers? Only surgery and radiotherapy. Chemotherapy and immunotherapy cannot cure by themselves. So you have to treat head and neck cancers for cure with surgery or radiotherapy. Early disease, stage 1 and 2, single modality therapy, either surgery or radiotherapy. For the oral cavity, we prefer surgery. For locally advanced disease, we use combined modality. That means you need more than one treatment. That's why I told you we must get our patients quickly into the hospital. You'll need surgery, then radiotherapy, then chemotherapy, and the whole treatment is prolonged for more than 3 to 4 months. Now, there are a lot of advances when we treat our patients. We have surgery, we have the laser, we have the endoscopic surgery, we have the robot, we have microvascular. Radiotherapy, we have various forms of giving radiotherapy, what we call IGRT, image-guided radiotherapy. And these are very technical terms on delivery of radiotherapy to minimize the side effects. In surgery, we do all these instrumentations to avoid outside cuts and treat our patients well. Chemotherapy also now is getting targeted, where you can focus on the particular tumor and minimize side effects to the rest of the body. And of course, we have great imaging now, where we can really see the structure in 3D and we can plan our treatment much better. I'm going to show you some photographs to tell you how we've progressed. Here is a head and neck patient treated by us 20 years back. Look at the kind of cosmetic and functional problems that we have. No chin, no lip. We've ripped the forehead. All his expressions are gone. We now do what is known as microvascular free flaps. We take out parts of the body harvested on 2 small vessels, which my plastic surgeon does. I give them 2 vessels in the neck when I'm excising the tumor, and we anastomose these vessels under the microscope. That's why they're called free flaps. So you can take out bone from the leg, you can take out soft tissue from the thigh, you can take out skin and fascia and put it into various parts of the head and neck and reconstruct well. This allows us to even do major extensions. Here is a case in point where we've excised nearly half one side of the face, and I can show you how these patients look. So here's a patient operated. There's the specimen on the left. Look at the defect. We reconstruct with free flaps. Look at the size of skin that we've gotten and put. About 3 months later, I'm sure you'll agree that he looks pretty reasonable. Another patient, more than half the face removed. We've taken out bone from the leg. And again, when you look at the final outcome, you will be saying that this patient looks pretty good. This would not have happened. So microvascular free flaps is the way to go. When we put bone, we can also fix implants and then put teeth for our patients. So patients no longer have to chew and avoid chewing. They can't chew, only be on liquid diets. But this is not for all patients, only for those patients that come early, have good hygiene, are strong enough, and can afford these implants that we put in. We can reconstruct the entire gullet. So here's a patient where we've removed the voice box and the upper throat. We've taken out part of the intestine. We've joined it together from top to bottom. And you can see the patient swallowing nicely, and there's good barium contrast going down into the patients. We also use our patients and treat them with the laser or the robot. And you can see how I'm cutting without making an incision from outside and taking out a tumor. So in a select subset of patients, we can use these methods of treating our patients so well. So the classical example is the cancer of the vocal cord, where we have here's the patient on the left with the cancer. We've done a laser resection. Look at him 6 weeks later. It's a one-time treatment, takes about 45 minutes to an hour. Again, all patients are not amenable to this. Here is a patient who was, because it was a superficial tumor, and he came to us very early. We now also resect into the nose, at the back of the nose, and high up into the brain. So in the old days, we used to do craniofacials where we used to excise, we used to take out bone, take out, here's the brain exposed, and then you would get these horrible defects. We now do it endoscopically, again, for a vast majority of the patients. Case in point, a patient who's being treated here for a big tumor in the nasal cavity. And you can see at the end of resection what a lovely clearance we have of the tumor. We avoid facial scars and other things. But to get all this, and this is my main message to you, patients must go to specialized centers. They must go to surgeons who only practice head and neck. They must go to high volume centers that do head and neck. And this is proven even in the US, where average care is much better than many hospitals in our country, that those that go to high volume specialized centers have best outcomes. And I must tell you, many hospitals have general oncologists, but that's a thing of a past, and you must look for someone who's specialized. So if it's a breast problem, go to a breast oncologist rather than just an oncologist. Go to a head and neck oncologist, go to a gastrointestinal oncologist, and outcomes will be much better. I'm going to end by saying head and neck cancers are a major problem in our country. They're largely preventable. They're amenable to early detection. Patients should be treated at specialty centers, and newer advances improve outcomes and maintains quality of life. I finished my short presentation. I'm open for the next 15-20 minutes for any questions that anybody may want to ask us.
Thank you very much, Doctor, for an excellent presentation. Those of you who have questions, please put them in the Q&A tab. And as always, mention your age and gender so that Dr. D'Cruz could give a very considered reply. Dr. D'Cruz, a general question on cancer, the situation of cancer, since you have been, since you were associated with the Tata Memorial Hospital for so long, and you are now head of a body like the UICC. What is the status of cancer care in this country? I still remember the days when one would be passing the Tata Memorial Hospital and there were people who were on the road sitting down there. I still see some of those signs, but clearly the fact that you have somebody like yourself associated with the Apollo Cancer Hospital, and there are people across the country where there are hospitals across the country. What is the status of cancer care in this country? Or does one have to go to a Tata Memorial Hospital, or do we have sufficient talent and infrastructure across the country?
So it's a very interesting question that you asked me. Of course, the Tata Memorial Hospital has been the, I would not say the first because the Chittaranjan was first, but the oldest hospital, and a hospital that's developed a brand, a good reputation among people across the country, that if you went under one roof, you would get standardized care at a reasonable cost. And I must congratulate our forefathers from the House of Tatas who had the vision to set this hospital up. But times have changed. Thanks to government efforts, thanks to the lifestyle of people improving, affordability of people improving, a lot of corporate hospitals that have come in. Today, patients have a great choice for treatment. So I'll tell you from my own life history. I grew up in Delhi. When I finished training and I came back from the US and I wanted to go back to Delhi, there wasn't a single cancer hospital that could take me. Subsequently, today you have just in Noida and just in Gurgaon, maybe 6, 8 radiotherapy and cancer centers, just in these two areas. Central Delhi has another 6 places that can treat. So just to give you an example, patients have choice. Now, not only in corporate, even in government sector, government has made a lot of efforts to improve cancer care. A lot of medical colleges are now stocked with cancer departments. Regional cancer centers are there in every state. So we do have the Tata Trusts are putting up cancer hospitals. So there are a lot of players. The Tata Memorial Hospital under the Department of Atomic Energy has a number of hospitals in Vizag, in Chandigarh, where else do they have them? In Assam. So there are many hospitals that are coming up. So people do have a good option, and you don't always have to go only to the Tata Memorial. Again, at the Tata Memorial, a waiting list for surgery sometimes is 6 weeks, 8 weeks. And that really is criminal because the tumor will double and immediately it goes from stage 2 to stage 3. You've dropped your survival chances by 20%. So search for places where you can get good care at an affordable cost. And I repeat my point, with a specialist, and you'll probably be safe and get good quality treatment.
Right. Thank you, Doctor. We have a few questions that have come in. One is from Mr. Basavaraj Nagashetty. He says he's 66. His brother, he never used any kind of tobacco or alcohol. He had an athletic body and never took any medicine prior. But at the age of 63, he got an esophagus carcinoma. What could be the reason, he asks?
So esophagus cancer also is caused because of tobacco, but some esophageal cancers which are at the lower end of the esophagus, what we call adenocarcinoma, is commonly caused by a reflux of acid up. You get changes in the epithelium called Barrett's esophagus, and those changes lead to cancer. So really, it's very difficult for me to answer very specifically what was the cause without knowing the details. But absolutely correct. Tobacco, alcohol, betel nut, that's the areca nut, are the prime causes of esophageal cancers. But the adenocancers can be because of just reflux and some genetic predisposition, some body habitus towards getting this reflux, which could cause these cancers.
So, Doctor, you mentioned about reflux. Now, acid reflux, etc., are common concerns that exist in this country, given our dietary habits and etc. So, at what stage of a reflux should one be careful?
No. So let me tell you that reflux may be one of the causes of laryngitis, may be one of the causes of spillover into the head and neck and causing inflammation of the arytenoids. But as a cause of cancer, please don't worry about reflux as a cause of cancer. So a person who is developing Barrett's because of reflux will have symptoms for a long time before they develop cancer. They will be symptomatic. They would have gone and seen their doctor. They would be put on antacids. They would be scoped once or twice. And if the doctor sees pre-malignant changes, he would raise the red flag and tell you, hey, Paddy, you have to come regularly for a checkup. You are seeing pre-malignant lesions. Please come regularly for an endoscopy. So all of y'all need not get panicky. You're getting a little bit of heartburn and run to the doctor saying, I've got cancer. No. Only when you have symptoms, you go to your doctor, he scoped you, he finds pre-malignant changes which are proven on biopsy. That's when you get panicky.
Thank you. We have a question from Girija Ganesh. Girija Ganesh says that you mentioned about sharp teeth can causing head and neck cancer.
No, basically, tongue cancer and cheek cancer can be caused by sharp teeth.
So the question is, should does it mean that if one has sharp teeth, one should get it treated by a dentist to make it blunt and remain safe?
100%. If you have sharp teeth which are impinging on your tongue or buccal mucosa, which is your cheek, you're getting frequent ulcerations on that. An ulcer, that's a break in your lining. Yes, please go to your doctor and have it slightly filed. You don't have to remove your teeth. In fact, if you see an ulcer, definitely don't remove your teeth, because when they remove a tooth, they open a socket, a potential route for cancer to get in if that ulcer is already a cancer. So get it filed, go and show a doctor. It is, but why I put that cause up? Many elderly people use dentures. Many of us are very casual with our dentures. Sometimes it's ill-fitting, it's rubbing on the tongue, it's causing abrasions. We are lazy, we don't want to go to a dentist at our age. Where are we going to go find a dentist, get it fixed? So my idea of putting that slide was to tell people that please do not neglect ill-fitting dentures. Do not neglect sharp teeth that are cutting and abrading your cheek or your tongue. Yes, you must get it treated.
Right. Thank you, Doctor. Doctor, I have a question from somebody who says, I want to stay anonymous. Given the nature of my question, I do smoke a bit, but not too many, 5 cigarettes a day. Is that something to worry about?
You know, you should not be anonymous, because guys like you have to be role models for the rest of people. You have to stop and then be a role model. So I hope you would give your name and then we can motivate you. Now, let me tell you, Mr. X or Miss X or whatever your name is, unfortunately, medical science does not know who will get cancer when they use tobacco and who won't. So you will have people in your friend circle, in your family, who will tell you, my grandfather smoked till 80 and he never had a problem. But I know many people who never lived to be fathers, leave alone grandfathers, because they got a cancer. So there are 2 important messages to you. One, tobacco in any form can cause cancer, whether you smoke it, whether you apply it to your gums, whether you sniff it as in snuff, or whether you chew it. All are dangerous. The areca nut, which we colloquially call the betel nut, is also carcinogenic. It's a grade 1 cancer-causing agent. So that is one, in any form. And second, in any quantity. So I know a priest whose nephew was on the ship in the old days. And his nephew used to bring this priest 2 cartons of 555 cigarettes whenever he came down from a voyage, every 6 months, for his uncle. He used to only smoke those 2 cartons over 6 months. So 10 packets into 20, 200, 400 in 6 months. That's about a cigarette a day. He got a vocal cord cancer. So my message to you, whoever has asked this question, is you have to stay stopped. And when you say stop today, the risk continues for the next 10 to 15 years. So you have to, even if you stop tomorrow, it's late. Today is the day you have to stop. So tobacco in no form and in no quantity. It's the only substance in the world that has absolutely no benefit, absolutely no benefit. And yet it is widely used by all our people. You know, it's just a habit that you take before the age of 19. And then usually most people persist with it. But a large number of people do give up the habit as well.
Doctor, what about passive smoking? He asks, the second question that he's asked.
Very, very important. Again, and very important question. So when I smoke, the smoke that goes into my lung is called mainstream smoke. The smoke that comes out from the burning tip of the cigarette and that comes out from my mouth when I exhale is called second-hand smoke or side stream smoke. Ladies who live with husbands who smoke have a 14% increased risk of cancer. Children who live when their parents smoke, either of them are having more frequent holidays from school, that's medical leave from school, sinusitis, cough, allergy, and various other things. That's why you're not allowed to smoke in public places. Why do you at the airport have separate kiosks to smoke? Why in government offices we are not allowed to smoke? You can screw up your lungs if you want. You have no right to affect me. In the old days, we used to smoke on a flight. There was a smoking section. Today, no one's allowed to smoke on a flight because you cannot risk others. And forget in public places, you're risking your own near and dear ones in your family. You have to stop. So, secondhand or side stream or passive smoking is equally dangerous.
Doctor, two questions. One is, this one is from Katie Dadanchi, who asked, Doctor, is it true that having sugar and sweet dishes can increase the chances of getting cancer, as cancer cells thrive on sweets?
So this is something that has come from the WhatsApp internet. Many people said, starve your cancer of sugar. Truly no scientific proof. I'll answer this in a different way. Sugar at any age is not good, excess of sugar. They're empty calories. And particularly when we cross the age of 45, 50, definitely you must cut down on your sugar. Have a sweet after dinner. You deserve it. You worked all your life so hard. There's no harm in having a bit of chocolate, one sweet, but you can't eat the whole box because increased calories as you get older, you burn out less. You will have all the buildup, which not only causes cancer, but will also give you a risk of cardiac diseases and various other problems. So sweets are not good to be had. If at all you have them, you have to have them in moderation. You cannot have them plenty. I must tell you that there are at least 6 to 8 cancers that are caused because of obesity, overweight, particularly in females. Breast cancer is obesity related. Uterine cancer is obesity related. Pancreas cancer is obesity related. So now imagine if you're eating your whole box of rasagullas or pista barfis every day, you're going to be overweight. You run yourself a risk of getting cancers because of obesity, not because of just sugar. So even control your calories, take a walk daily. As I tell my patients, buy a 4th standard science book, read what is a balanced diet and a healthy lifestyle. What we taught our kids, why did we forget it in the course of our life? Just do it and we'll have a lower incidence of cancer.
Doctor, one last question. Again, I think this is much circulated on WhatsApp. Is, Doctor, what is is there a problem in chewing gum because of repeated mouth movement? Is there a fear of getting cancer because of that?
No. There is, you can move your mouth as much as you want, but if you talk too much, you may make some enemies because all of us tend to shoot our mouth off. But there's absolutely no proof that if you talk more, you will get more cancer. So please, you can take chewing gum, but please remember that chewing gum again has sugar, and always keeping your teeth bathed in that solution may not be the best for your dental hygiene. You can develop caries and other things like that. If you constantly grind your teeth chewing things, it will cause abrasions of your teeth and wear out the enamel. But there's no harm. If you're habituated to chewing gum, it's much safer than having your 5 cigarettes a day.
Doctor, one last question to you as a personal question. How does Dr. Anil D'Cruz keep ward off cancer, ward off the fear of cancer? What do you do in your lifestyle because you have a very busy lifestyle, you have a lot of stress in your field. What do you do to ensure that you are are keeping the big C at bay?
So there are 3 things. Remember that 2/3 of cancer are lifestyle related. 2/3. And of the 2/3 of cancer, the 3 important things in your lifestyle are your habits. That is tobacco, alcohol, supari. Stay away from tobacco. Stay away from the supari. And if at all you drink, social drinking in moderation. You can't finish a bottle of wine, drink 2 glasses, which are as big as buckets every day and expect. So habits absolutely controlled. Second, infections, hepatitis, HIV, a human papilloma virus, all either blood product transfused or sexually transmitted. So have a healthy hygiene has to be maintained that you don't have infection. And third is obesity. That means don't go overweight. Just a little bit of moderate exercise, eat in moderation, and 2/3 of cancers will not be there. Now, as I get older, I might get a prostatic cancer, which is age related. But if I've had a healthy lifestyle, I've had a balanced diet, even among men who get prostate cancer, those that have these good habits, the incidence is lower. So a healthy lifestyle, avoid 2/3, and most importantly, pray to the good Lord above. We all fight for money, for wealth, for position, fight with neighbors, fight with family. But if you don't have good health, whatever you wanted is of no use. So the fourth thing is pray, or I should say the most important thing is pray.
So very well said, Doctor. Thank you very much for this excellent presentation. And apart from the excellent presentation, several home truths that you have said even while making the presentation, which would perhaps be applicable for not just the head and neck cancer, but other cancers as well. Thank you very much to Dr. Anil D'Cruz for this session. And thank you to the folks at Apollo Hospital for facilitating this. We will be back once again next Saturday, that is the 17th, for another session of Health Live at Seniors Today at 5 p.m. Once again, thanking you, Dr. D'Cruz, for taking some time out on a Saturday evening for this session.
A pleasure. Thank you for having me over. And I put my coordinates up on the last slide. If there's anybody who needs to have any questions answered, any doubts, I'd be delighted to answer them offline as well. Thank you once again.
Thank you very much. As always, this session, the takeaways which are written by a qualified medical practitioner, as well as the edited video, will be up on the website on Monday evening. You can have a look at that for all of this. Thank you very much.
Thank you.